Welcome to the Innovation Room, the space we explore the application of technology and AI in business, the practical and sometimes philosophical ideas shaping our future. Picture a healthcare system where AI-driven insights provide personalized care plans, anticipates health issues before they arise, and offers support tailored to each patient's unique needs. How does AI enhance the connection between the patients and healthcare providers, making interactions more meaningful and effective? What new possibilities emerge when AI empowers patients to take a proactive role in their health journey, improving outcomes and satisfaction? I have invited Tia Cheang, a seasoned data and strategy leader recognized as one of the Data IQ 100 2024 and awarded a Tech Exec Data Leader of the Year 2023 for her success, achievement, and inspirational leadership in the global data community. She has spent the last 20 years in insurance, telecommunications, and a long history of working with NHS, but most recently disrupting the patient engagement with AI in the health and lifestyle management sector, and advising UK Parliament on AI. I am Somaya, co-founder of Geeks. Join me in the Innovation Room with Tia Cheang as we explore the future of patient engagement with AI, a future where technology and compassionate care go hand in hand, creating a more responsive and personalized healthcare experience for all. Well, hi Tia. Thank you very much for joining me in the Innovation Room. Lovely to have you here. And
absolute pleasure.
why don't we start with a bit of introduction about you and who you are, a bit about your journey?
Yeah, sure. So I'm Tia. I'm the Chief Product Officer over Nexus Digital Technology. We're a health tech company that specialize in patient engagement. So we use digital platform to help educate the patient and help them optimize their health. And there are a number of different elements within that. There's videos, there's multimedia, but a lot of it is driven out by, it's very data driven. So we collect data through wearables, but there's stuff in there that also drives insights and recommendations engines around the education materials, there's gamification. So it's a very data driven product that happens to be focused in a healthcare space. My background is in data. I've been in data now for about 20 years. And in my last role, I was a senior director, CDO in financial services. But prior to that, I'd spent maybe 10, 12 years, something in that region, working in the NHS, right at a very senior national level, and driving out kind of what the national strategy needs to look like for health to improve the patient's overall outcomes, which is basically how their survival rates when it comes to healthcare. And as I say, now I'm Chief Product Officer, and it's really great to be able to put my own fingerprints on what I think patients need, and drive that out and have a real sense of hands-on as well as vision. So I'm enjoying that very much.
Well, thank you again, Tia, for joining me in the Innovation Room. We have a tradition to start with, which is who would you bring to the Innovation Room with yourself if you wanted to do some serious innovation work, dead or alive, fiction or real? And we do allow more than one person if you really want to.
So I thought this was like a pretty tough question to be asked. And I thought about it quite long and hard. And originally I was thinking, who's the best technologist? Who's the best technologist? And over a number of days, I kind of realized that technology is probably just going to get there regardless. It might take us a little bit longer, it might not. But the technology is just kind of trudging along and progressing, and it will kind of figure itself out. For me, the bit that I'm worried about with my patient hat on is very much around my rights as a patient, the rights of my data, and that kind of data ethics, AI ethics piece. And my mind shifted into, well, who actually would I want in the room as like the devil's advocate? So I'm off there, if I think about, the Manhattan Project and building nuclear weapons, who was the oversight in that room as opposed to just the scientists cracking on and being geniuses? And I thought about it and I was like, you know what, I'd like to invite George Orwell. So the writer, he did 1984, he did Animal Farm. It's very much around what are your rights, what is okay, what is not okay, how much is overstepping, what kind of what is too much government interference in what you want to do, particularly from a healthcare perspective. You're giving all of your data over to the
Mhm.
NHS, which is essentially government, and what could they do with that? Well, in a very dystopian world, maybe they use that data to profile you, and maybe that could be used for credit scores, or maybe it could be
Yeah,
used to affect your mortgage, because they could say, well, actually, Tia's got a heart condition. Maybe she's not going to make it to 70. And so maybe a
yeah,
30-year mortgage is not for her.
yeah,
Those kind of things could be quite dystopian. And we was in a conversation yesterday about data ethics. And whilst we quite regularly think about a high level use case, and then we go, is this ethical? And we go, yes. The problem is this sort of slow entropy and erosion over a number of releases, where the product sort of grows and evolves. And then suddenly, if you look 3 or 5 years down the line, the delta of change that's happened may significantly erode your rights. And so I would like someone who's thinking of it less from a technology perspective and more from is this the right thing to do? And who's got like a real kind of objective eye to kind of go,
yeah.
no, Tia, don't do that. And pull
You
people
know
back a
what
little
could
bit and say,
happen.
actually, just because you can do it doesn't necessarily mean you should.
Yeah,
So that was my thoughts. I'd like someone like George Orwell to kind of,
yeah.
and plus, I like reading, so that'd be an interesting chat anyway.
Yeah, that's a very interesting choice, and a really good segue to the rest of the podcast, especially the first
Mhm.
question, which is about the stakeholders. So in the healthcare
Mhm.
system, it's a complex system, isn't it? So
Yeah.
there are a lot of different types of stakeholders involved. So it might
Mhm.
be one of the most complex industries when we want to talk about AI and how is it going to impact it. The challenge I see with the stakeholders of the healthcare is the kind of conflict of interest, massive conflict of interest between, while they share some, visions, benefits, and concerns, but there is a massive conflict of interest of different stakeholders. Um, and it could be a really really complicated conversation which we wouldn't have time to fully dive into. But from your perspective and the work you have been doing, if we narrow it down to patient engagement being what you're doing within the healthcare sector with your company, what are the stakeholders, what are the tensions between them, and how do you manage that, how do you
How to
navigate
balance them. Yeah. So for us, I think if you ask most people, they would kind of go, well, obvious one is the patient, and there's plenty of diversity in patients. Not all patients are created equal. They're different ages, they're different abilities. Some might be whether those abilities are able-bodied, neurodiverse, learning disabilities. Maybe they've got dementia, maybe they're really old, maybe they're really young, maybe they're in a wheelchair. There's a whole raft of different um, types of patient stakeholders you have in that group. So you want a diverse group. Then you've got clinicians, some of which are patient facing. So you might think of doctors, nurses, physios. But then you've also got clinicians who are perhaps not patient facing. These are people like radiographers who, you go to your MRI scan and they'll do that piece of work, or maybe they work in the labs. There's those. And some of them, if you think about who you're actively engaging with and who you're informed, you can swap those in and out. Then you've got the people who manage your contracts. So they're sort of senior managers, directors in the organizations you're contracting with. So they could be hospitals, people, places like that, chief execs. But there's also regulators. So
that?
for us, we're a very heavily regulated industry. Can't get the words out today. Very heavily regulated industry, and so these are people like NHS England, MHRA, NICE, who are very interested in not only is your platform safe from a cybersecurity perspective or from a data perspective, but actually from a patient safety perspective, is it going to do harm to the patient? So particularly when we look at the evolution of AI into what is now an explosion of apps that are now coming into the marketplace, there's been a recent change in the regulation to sort of stratify the risk on those. And for anyone that's doing anything that is predictive, that looks at predictive diagnoses. So where you're looking at a number of health indicators and say, maybe this could be something you might be looking at. You could have heart disease. Even if it's not saying explicitly you have heart disease, but it's inferring that it's a possibility, that is then taken as quite risky. And they're classed as 2B medical devices. And there's a huge amount of sort of regulatory compliance that you need to go through to ensure that your product is safe and is built in an appropriate way, and also doesn't scare the patient. So there's those to consider. And then there's the usual stuff, when you're looking at regulation around the ICO and places like that. So there are big, chunky stakeholders, some of which we engage with in a light fashion, and aren't necessarily when we're involved when we're doing program release or project release into a hospital. But they're people that we need to just engage with and keep informed. And for us, they're kind of our core.
So specifically about what the work you do, what are the tensions between these stakeholders that you have identified or you have had to deal with?
Yeah, so for us, working as a patient engagement platform, there's definitely a tension between us and, in some cases, the clinicians. So where many platforms are different to where we are, is that they very much focus on how can I digitize the current administrative processes that happen in a hospital. So how can I make an e-form to do a referral? How can I, move that patient around administratively? Whereas we're slightly different in that we say, actually, if we were to take the idea of care and totally reform it and say, if you were to redesign something completely from scratch, rather than basing it on something that was designed in the 1900s, and say, you have all the technology in the world, how would you deliver care? Well, you might want telehealth. You might want the ability to do your diagnostic tests at home. You might want to be able to do remote health monitoring, through heart monitors or urine sensors or something like that. So it's kind of through wearables, rather than dragging the patient into hospital. And where the tension sometimes sits is around clinical risk or perceived clinical risk, and winning those stakeholders over to say, actually, we've tested this. We have an evidence base to say, actually, patient outcomes are better than bringing patients into the hospital. Patient satisfaction is higher than if you bring them into hospital. Waiting times are lower than if you bring them into hospital. And having that discussion, and it's definitely a battle of hearts and minds, because you're teaching them something or you're showing them something that is completely revolutionary to them, because it's not a way of working that is traditional. And clinicians are very risk averse. They're very much focused on what is the route that that is known and trodden, that is going to keep my patient in the safest space. And until you can show them that evidence base, it can be really difficult to get their buy-in. But we've done numerous pilots. We've got evidence bases. We've got case studies, and being able to share that with them gives them the transparency and reassurance that actually this is something they want to be involved in. But that's really where we find the most challenge is kind of getting people's heads around this new way of working.
That's a very interesting thing, because I was thinking, but when I was prepping for this, I was thinking actually one of the biggest challenges of adoption of AI or integration of AI is how do we train or educate people to be able to think differently, because it's a different type of technology. We are not automating. It's kind of like if you just automate what has been done, it's kind of not using the
Tinkering
technology.
around the edges. I think you need to think about. I mean, they're almost brand new use cases. So instead of just, we think of it in the sense of whole system transformation. So rather than kind of going, how do I transform this small team over here? If I was to take a big technology and look at it as a kind of intersection of industries and say, actually, how could I blow this up and be completely disruptive, rather than just doing a little bit of transformation over here? What would the impact of that be, and how would I design it? And that's how we see ourselves in the market. We're not thinking of how can we support you in your existing administrative running of a hospital
Yeah.
or management of patients. We're actually saying, let us come in and let us support you in a new way of thinking with this way of engaging patients. So if you think about if you're I don't know, say you've got, I don't know, a heart problem, you're going to
Mm-hmm.
spend of the next month 29 days at home or at work, and
Mm-hmm.
maybe half a day at your GP surgery or at the hospital having a scan. And so the amount of time that you spend with the clinical team is really minimal.
Mm-hmm.
And so they don't really have much oversight, much ability to see you, much contact with you, much ability to influence your health in those other 29 and a half days. And so actually having this concept of healthcare in your pocket, because it's a mobile-based app, they can then have outreach in a way that they haven't had before. And the patient can be more informed and help train their behaviors to help improve their own health on the other 29 and a half days. And that is really powerful because, if you think about tinkering around the edge, half a day really is tinkering around the edge. Whereas now
Mm-hmm.
you're having suddenly this whole totality of a patient's life that you can influence.
Yeah, yeah. Very interesting. So now going to the constraints and the challenges, and I'm following our Dare or Die Bullseye, which is a framework we have
Mm,
developed and used to look at the future of different businesses, and we are just following it, the future of the healthcare, with the laser focused on patient engagement within
mm,
the, because healthcare is too big of a thing. So
mm.
if we think about where we are and sometime in the future as the point we want to transition to, how transformation happens over in reality, in real world, we won't parachute ourselves and everybody in the society to that space. We have to
Mm.
navigate a billion points in between, the two, and it's not going to be a straight line either. So there will be some stuff like what you're talking about, which is emergence of new ways of doing
Yeah,
whatever we're doing, because there is a new technology that enables us to do things that we weren't able to do before. Which the challenge there is, how do we even imagine? How do we even create or innovate those ways, new ways of doing things? How do we think the way which is different from how we were thinking before? Another part of that transformation is going to be improvement of the old ways, and we
yeah,
can't leave either of them. So if we just focus on improving the old ways of doing things and automating them and making them better, optimizing them, then we get somewhere. So if we ignore the emergence, it will only get us somewhere, and we will be slow to completely
yeah,
transform the society. But if we only look at the emergence of new things, then we are going to have so much resistance from the society, because what are we going to do with so many old ways of doing things that we
yeah,
have
yeah.
to transform them for them to get there. I saw this when it's a bit of a tangent, but I was listening to BBC Radio 4. They have a program called Artificial Human, when they look at AI in different things. And there was a episode on what can AI do for Glastonbury music festival, because we are in
Mm.
summer and Glastonbury is big. And I was surprised how much everybody was thinking about how AI could optimize the toilet queue and this and that. And there was no thinking around what could we do with AI that is completely impossible without. It's
Yeah.
completely
So
impossible to.
there's, I, I think there's some really good examples that you could translate from that. What could you do at Glastonbury? That could you do at healthcare? So I'm absolutely on board with this idea that transformation is both a slow train and a fast train.
Mhm.
Where yes, there's emerging technologies happening all the time, but the uptake and enablement and embedding of those takes time. So even if I finished a transformation today, I've got to give it time to kind of work. People want an ROI, and if I go from one transformation straight into a back to back another one, they're never going to see
Mm.
any ROI. So there's going to be stages along the way. And you also want to consider how much change is enough to justify doing another transformation. So, just because GPT-5 is coming in 18 months, for example, doesn't necessarily mean I want to, leap from 4 to where I might want to be in 18 months. I might want to wait till 6 or 7. There's definitely a trade-off where you kind of go, how much am I getting for value for money on this? And so I think it will be a step change where we kind of go, okay, transformations might start happening next year. People need a lead time. That'll take 2-3 years. Then we might see another one around just 2030, maybe. People will start thinking again, and then maybe 2035, they'll kick up another one. Those kind of things, I think, will take time. But when you kind of think about that Glastonbury idea, and you think about queues for toilets, well, actually, we think about these things, and we already do them in healthcare. So we have and have had AI and machine learning in place for quite a long time. It's been a very data-driven organization for over 10, 15, 20 years. It was one of the first big organizations to take it up because, you've got to do more with less. And so thinking innovatively and leveraging machine learning was something they do around bed optimization. So if you think about how many hospital beds you need and how long a person stays in there, it's the same as the kind of waiting times for a toilet at Glastonbury. But when I also think about products that actually we've been scanning that are available now in the health tech space, we were looking one quite recently that actually can do facial recognition, which is great. But actually, if I think about that Glastonbury idea, if you think about facial recognition, we tend to think about it in terms of police and, riots and those kind of things and football hooliganism. But actually, you can use facial recognition to look at heart rates, to look at how well people are, to looking at rates of depression, because there's small micro indicators that can come across in video footage like this, where actually you could be my doctor sat at home and I could have my webcam running and it could go, Tia's heart rate and blood pressure is this, just based on the image without even having to put on a heart rate monitor. And if you think about Glastonbury, yes, I could scan them and I could figure out if it's a heat wave, who's going to pass out, where should I head that ambulance team to go and do that? Because there's a lot of that, at Glastonbury, people are drunk, they're been out partying, they're exhausted, it's hot, they've been awake for 48 hours, all of that stuff. You could use that technology in that space to help revolutionize how they manage safety within a festival. But equally, those technologies could be used in a healthcare space. Those use cases are kind of equally leverageable in different industries.
And in terms of the challenges and constraints, we know, like, probably healthcare is a space that, because of the history of AI being already used, different types of AI than Gen AI before Gen AI was created, we kind of know the ethics problems. We kind of know their privacy and security and all of that. So I don't want to go necessarily into them. That we're dealing with very personal information of people, and you need to be careful about that. What I want you to comment on is what we have learned from this that is going to make healthcare different to other industries that haven't done this. So for example, I don't know, construction hasn't implemented AI to the or technology for that matter, to the extent that healthcare has implemented, or some parts of healthcare. We don't talk about you still have papers going around in hospitals, but like some part of the healthcare, cancer, diagnosis, image processing, radiology, some parts of surgery, they have used AI for a long time. So what have we learned from how to navigate the privacy
Yes.
and those?
Yeah, absolutely. So the first thing for me is around your stakeholder engagement. So one of the things that's really difficult for us as technologists and clinicians as well is that sometimes they can be a little too close to the coalface to see, to kind of figure out the woods from the trees. And so wearing multiple hats of, I want to be more efficient, I want to, see return on investment, I want to drive innovation. It's really difficult to kind of step away from that and go, actually, what is best for the patient? How do I protect their privacy or their rights or whatever? And where we've seen that done best, and I've kind of done this in other places where I've worked, and it's something we're building out at Nexus at the moment, is around bringing those patients into that conversation and having a period of co-design where actually we're saying, this is what we've got in our roadmap. What do you think of it? Do you agree with it? This is the implications of it, and having real transparency on that.
Mm-hmm.
And if you're thinking about it in, construction, you're probably not thinking about patients. Maybe you're just thinking about what kind of HR information within my company can I harvest and can I use it for this, this, or this? Maybe you want to consult your employees about that and see whether they're happy about it, rather than just consulting the management team. Having that sort of the people who are impacted consulted, really important. So I would say that for a start. The other bit I would say is, at least for now, the AI is whether you're thinking of that as machine learning or you're thinking about Gen AI, it's very much about human augmentation and not human replacement, particularly in high risk areas. So if I think about what the work that's happened over the years to look at, say, cancer screening. So if you think about going for breast cancer screening, there's AI that can actually look at those images, scan them, and to a high level of accuracy, much higher than you might typically experience, identify potential tumors. But I wouldn't want to rely entirely on that. What I want is it to flag up potential tumors, and then a clinician to look at it and go, yes, I agree with that, or no, I don't. Because I don't want to put someone through radiotherapy who might not necessarily be a relevant patient, for example. So there's those kind of things. It's about augmentation rather than replacement.
So can I
And
pause
then,
there? Can I just pause there? Because you mentioned something I was going to ask later on, but that's the role of human in
mhm,
in the patient engagement part. So what is the role of why would you want somebody else to look at that if you know, for example, 100% or 99% of the time that
mhm,
AI diagnosis is accurate? Why
yeah,
would you want that human to look at it? Because you wouldn't want, well, sometimes you get second opinion, but normally if you go to the doctor, they diagnose you, you trust them,
yeah.
they know their thing. If they say I have this thing and they prescribe like antibiotic, I'm going to take the
Yeah.
antibiotic. So what is the need for human? What's the role of human in that
Yeah,
patient?
so it's about that 1%. So 99% of the time it could be accurate, but the 1% is really where clinical expertise comes in. So
Assume that is 100%. Assume we get to the place that the AI is
mhm.
100% accurate. Would you
so
want
if
not having a human involved?
Yeah, so if I think about, if I had an AI and it was perfectly accurate 100% of the time, there's still other clinical considerations. So if I was diagnosed with breast cancer, for example, and they said, well, you need chemotherapy, and the AI immediately booked me for chemotherapy. Well, what if I'm pregnant? What is the consideration on that? And do I might want to have wouldn't know that. So I would need to have a conversation with my consultant, and there's information that needs to happen where my consultant might say, these are the implications. Is that a type of treatment you would want? And some patients, they kind of go, I'd rather have quality of life to death rather than go through treatment. And so there's a whole bunch of things that you would want to consider rather than just have the AI deal with it in entirety.
Assume that they are, because AI would have access. Like, well, if we get to the point that it's like 100% accurate and it's really, really good, it's going to have access to whole your medical history before booking you for a chemotherapy. It's gonna think
Yeah.
about like, are you pregnant? Are you this? Are you that? So it's gonna think about all of that. It could even, and we do have like I don't know if you've used, for example,
Yeah.
Pi. You can have a conversation with it, and it's quite like it projects a lot of emotional intelligence and a lot of empathy. So it can
Absolutely.
even have that empathetic conversation with you around your choices and help you make that choice. But personally, I still believe you want a human. That's why I might be a bit biased pushing
I
you to say,
do.
okay, what do you
I,
think
I
we
think
would need a
I think if
human?
we consider, I mean, going back to this slow train, fast train thing, at the moment we're in the slow train, and we know that this world where AI is super ready to be able to take away all of that diagnostic piece. That seems a long, 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 long way away from where we are now. But if we were, and we're in Star Trek world, and that's now,
Yeah.
there's still a question around: would people want care from a robot or a system? And would they prefer a more empathetic human touch? There's a difference between clinical stuff and care. Care is caring. And would you prefer that from a human, or would you prefer that entirely from some digital system or robot? I think there's still an aspect where people want human interaction, but actually we don't need uh, all of it to be human interaction.
Mhm.
And there's some stuff where actually the AI augmentation and support can be really helpful. Um, and there's a level of trust as well. I'm not necessarily sure humans are ready to trust AI blindly for everything yet. It's still, IT, digital stuff, still relatively new in the history of humanity. I don't think humans are ready for that.
Mm.
And so there is definitely a human trade off around care needs to be caring, alongside, how do we drive innovation and use technology in a way that makes sense and actually improves the overall health of the patients. I think there's a huge amount of relevance in that, but
Yeah.
care still needs some form of human to deliver the caring element.
That's a very interesting and complex topic, I think. I have a
Mm,
theory that we would want humans in the loop of care because that placebo effect of white coat of the dog. You see it, you just feel better by just seeing that there is a doctor, looking
yeah,
after you. That kind of element of like you want to be cared for by um, someone or something that understands pain, that understands the vulnerability of being sick. So that's the comforting element. However, I think because on average you don't get that experience. You go to the hospital, you go to the doctor, they're busy, they don't like they
yeah,
see so many patients, they become incentivized to them and they
yeah.
stop caring as much. So my
And
theory is if we have technology involved in the areas that it doesn't need that human touch, then we would end up with needing less humans for those human touches. And
yeah, and
hopefully, we would get the best of the humans who care to be in those positions, and we get the best caring of them in those areas. So that's how we get the best.
yeah, and that's exactly where the product is aimed at. So it's this idea of actually, if we could take the work away from being, the bits that aren't necessarily the care parts, that keep a GP or a consultant overloaded, which is, I've got to fill in this form, I've got to send it off, I've got to write a referral, I've got to, make sure this prescription's done, and those kind of bits and pieces. I can then focus on actually caring and understanding my patient better,
Mm,
and where the heavy lifting is done by a digital platform, then actually I can do more of the stuff. It frees me up to have the availability to go back to what was a vocational calling in the first place, which was to help people, as
yeah,
opposed to I wanted an admin job to fill in forms.
yeah.
And that's kind of where we're playing in this world, where we free up people's time to focus on care by delivering in a digital fashion a lot of the
Mhm,
stuff that actually we could do with technology and with AI and with
mhm.
sort of self-service.
Mm. And you touched on your platform and the product that you're building, solving a problem in a different way. You're poking the system in a different way.
Mm,
So, what are the current problems? So, I want to explore a little bit. What are the current problems that are being solved at the moment, with or without AI or technology?
mm.
Um, and what are the things we are not, and that's a difficult question, but what are the things you're not thinking about? What are the problems we are not thinking about, or not enough of us are thinking about solving? And are you solving one of those problems?
Yeah, so I mean, healthcare is a vast arena, and I can never be in a position where I can solve all problems with one platform. So you pick a playground to work in, and you try and do your best in that area. So there are huge developments happening in other areas. So if I think about using genome mapping to look at personalized medicine, so your genome is different to mine, and because of that, certain drugs that might be more effective for you are not as effective for me. And using that genome scan to then kind of say, actually, you would suit better with this particular drug in this particular drug group to have the best survival rates or the best, the best uptake of those drugs.
Well, let's
That's
focus.
something really revolutionary.
Yeah, let's focus the question on the patient engagement. In the area of
Okay.
patient engagement, what is being done now, and what are the things we could be thinking that we are not thinking about?
Yeah. So if I go back, if we think about patient engagement and that concept of you only being in the hospital half a day a month, that other 29 and a half days, most patients go home and they think about their condition, but they don't think about behavioral changes.
Mm,
So if I think about having a heart problem, for example, I might want to think, well, actually, I've got a bit of weight to lose. How do I shift my behaviors? And maybe that's around dietary advice. Maybe it's around recommendations of food. Maybe there's day by day, step by step milestones that I can hit, and things that can keep me on that path that are going to help me with my heart condition. And they're not necessarily just about taking a drug. The stuff around making sure that I'm adhering to my clinical care pathway, which are things like I've got to take my medication every morning, so we can do notifications and reminders. But there's also stuff in there around general patient awareness and education. So if you look at particular conditions, you'll see that a patient might get a referral from their GP to go to the hospital. They'll go to one appointment, which will be their scan. Many of them over that treatment and diagnostic period will just drop out. And it's because they've lost enthusiasm, or they've lost a sense of connection to that
mhm.
condition and that clinician, or that, whatever it is. And they'll drop out. So they might
Yeah.
not actually get to the end of the treatment pathway. Maybe it's waiting times,
Do
whatever
you
it
have
happens to
any
be.
do you have any statistics of like how what's the numbers, or what's the
It's
cost of that to the
Oh,
care,
it's
care system?
enormous. So if you think about patients who don't attend appointments, in some conditions, in some clinics, it can be up to 50% of those first time appointments they don't attend, and then you still have dropouts at the second stage, third stage, with blood tests and so on. And so the cost of those missed appointments is huge. But actually, the cost to the patient's health, if you think of their
Mm,
condition, is vast.
mm.
They're just going to
Yeah,
deteriorate.
yeah.
And so by educating the patient, keeping them in that pathway, sending them notifications, having a way to remind them, because if you think about elderly patients, maybe they have dementia, or they may not necessarily understand their condition as well as you might think. Having a way to not just send them a letter, and then Royal Mail's not particularly reliable at the best of times in the post. You can now send them a notification on their phone that says your appointment is next week on Tuesday with Dr. Samaya. Don't forget, you need to
Yeah.
bring in this. And actually, there's a constant reminder in their pocket of the things that they need to be doing. And that helps keep them on that pathway of,
Mm,
of treatment, helps keep them attending their appointments, but also helps keeping them do the stuff they need to do in the background around taking their meds, making sure they're getting 10,000 steps a day, those kind of things that help optimize their health and keep them well for longer.
And what are the in your roadmap? What are the, if you're going to pick, and if you can share, one of the most exciting um, things in the roadmap that you're most excited about?
Yeah, so I think for us, uh, we're currently working in the cancer rheumatology space. Next one for us is dermatology, and then cardiology as well. But when I think about the general features and functionalities, the kind of capabilities in the platform, the stuff that I'm really getting excited about is the amount of data that we can garner from wearables. So we already have integrations with your Fitbits, your Garmin's, your Apple Watches in that space, but actually we're beginning to now look at what we can stand up from a um, clinical wearable position. So we've done stuff in prostate cancer. So we want to be able to have urine sensors that people can have at home, and having full integrations to those, and having integrations into research platforms. So for hospitals that are doing clinical research, actually we can help drive that out with patient insights, and actually help modify some of
Mm.
that kind of clinical innovation. So it goes beyond the kind of immediate patient care into that ripple effect of actually what can we do in other spaces. And I think that's really going to be powerful for the overall wider healthcare sector.
Mm-hmm. And we could continue this conversation for hours, because it's a two very interesting topic, technology and
Yeah.
humans and health. But we are short on time, so what would be your um, word of advice for business leaders, for organizational leaders in the health sector, or specifically in the even in the patient engagement part of the health sector, when they think about AI and how to engage with it, based on your
Yeah.
experience?
Yeah. So for me, we're looking at the regulation very carefully at the moment. So it's obviously in its infancy. We've just had the EU AI Act come out. The UK AI Act has been put on hold just while we go through the election period. But if you think about large scale investment, and it is an enormous amount of investment you're looking at, because you can't just take an existing Gen AI model and put a rag over the top. You are looking at training your own model, and the volume of data and the number of records that you're going to have to look at to be able to do that in an effective, risk-averse way is vast. So the cost of that is enormous. And so we're looking at regulation kind of going, we don't know what's going to come next. So we're looking at the low risk applications, where I can say, actually, what could I deliver now that I might not necessarily have to roll back in 18 months, having spent millions and millions of pounds on
Mhm.
that. So there's that aspect. The other aspect is thinking about making sure you've got the appropriate certification. So I see new entrants into the market who haven't really thought about, am I classed as a medical device, or am I a wellness app? And they're very much playing in the healthcare space and need regulation. They need regulatory compliance, but they haven't achieved it because they haven't done their research. So I would say definitely consider those, and how you get that. But I'm also really concerned about, well, not concerned, but I would say people really need to be engaging with their patient base when they're thinking about not just building AI, but thinking about implementing AI. You're on the customer end, you're a hospital or you're a GP, and you're going, what could I use AI for? And thinking about whether your patients would want you using AI in that space, and having a public patient engagement or consultation with them, and feeling out whether they feel that's appropriate. I mean, quite often we put in systems in place, whether that's in healthcare or whether that's in general commercial spaces. If you think about Amazon, AI has been there for forever, doing recommendations in the background based on your previous purchases. But we don't think about these as models. We don't think about them as AI products. They're just there. They're happening in the
Mhm.
background and have been for a very long time. And we've always shared our data with companies like Tesco with club card points and those sorts of things. But I'm not necessarily sure patients have the awareness of what their data could be used for, and there's a level of transparency that needs to happen there. But I don't think they're aware of where their clinical care could take them in the future based on the technologies that are beginning to emerge. And so having those early consultations around your thinking, I think, is really, really important, so that they can have an informed decision about whether they want to engage with that.
Wonderful. Thank you so much, Tia, and I
Thank
look
you so much
forward
for
to
having
hear.
me.
I look forward to hear how,
Excellent.
your platform revolutionizes the patient engagement.
Thank you.
Thanks for joining me.